Welcome to YourFourthState.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you, Dr. Michaels.
Nice to see you. Thank you.
Now, our question for you today is, what are ingrown toenails?
Well, ingrown toenails are basically a condition when your toenail grows into your skin. It creates a foreign object effect, basically, and your skin tries to attack the toenail that's ingrown into it, creating an infection.
All right, so tell us how we go about treating this.
Well, since it's so common, we're avoiding tight-fitting shoes, avoiding trauma to the toenails are really the two main things that cause it, and to treat it, sometimes just changing the shoes can help. However, sometimes that doesn't work and you have to have treatment. Oftentimes, doctors will prescribe antibiotics, which really does nothing for the condition because the problem is the toenail is growing into the skin. Trauma can cause this. There's a root to the toenail, and wherever you have a root, you have a toenail growing out from that root. Now, trauma can affect where the root is located by squishing it basically from the center to the side of the toe. Now, if you have root on the side of the toe, you're going to have toenail growing out there too, so it curves in and cuts into the skin. This can be easily fixed, not really with antibiotics, but with a small procedure done in the office where the toe is completely numbed. That part doesn't really hurt that bad, and after that part's done, you don't feel anything. So it's a pain-free procedure from there on. You remove basically a small sliver of toenail on the side of the toe, and afterwards, which this process takes about 5 minutes, afterwards there is a special soap that we would provide. It's called Hibiclens. You wash your foot with this once a day, and there's a special dressing that we have you put on. It's like a Band-Aid, and you put that on once a day, and after about 2 weeks, you're healed, the infection is gone, and you're back to your feet. The nice thing about it is you can walk out of the clinic with your shoes on, and so there's really no period of non-weight bearing after this procedure, which only takes about 5 minutes and is very minor to do.
All right, thanks so much. Once again, Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your questions about foot and ankle conditions only here on YourFourthState.com.